Hello and welcome. Today, we're diving into a common, yet often misunderstood condition affecting the digestive system: gallbladder polyps. We'll explore what they are, what causes them, how they're diagnosed, and what treatment options are available. So, let's get started on understanding these fascinating growths within the gallbladder. The exact cause of gallbladder polyps is not fully understood, but several factors are thought to play a role. Some polyps are linked to cholesterol deposits in the gallbladder wall, often referred to as pseudopolyps. Other factors, such as chronic inflammation of the gallbladder, known as chronic cholecystitis, may contribute to their formation. Genetic predisposition might also play a part, making some individuals more susceptible than others. While a definite cause remains elusive, researchers are actively investigating these potential contributing factors. Let's delve into how gallbladder polyps actually form. The gallbladder, a small organ located beneath the liver, stores bile, a fluid that aids in digestion. Polyps, simply put, are abnormal growths that protrude from the lining of the gallbladder. These growths can vary in size, shape, and number. Cholesterol polyps are the most common type and arise due to excess cholesterol accumulating in the gallbladder wall. Inflammatory polyps are a result of chronic irritation and inflammation, while adenomas are benign tumors that originate from glandular tissue. In rare cases, a polyp can be malignant, meaning it's cancerous. The risk of malignancy is generally related to the size of the polyp, with larger polyps carrying a higher risk. Gallbladder polyps are relatively common, affecting an estimated 3 to 7% of the adult population. They are often discovered incidentally during imaging tests performed for other reasons. The prevalence tends to increase with age, and they are somewhat more frequently found in women than in men. While polyps can occur in people of all ethnicities, some studies suggest certain populations may have a slightly higher incidence. It's important to remember that the vast majority of gallbladder polyps are benign, and many individuals with polyps remain asymptomatic. One of the tricky aspects of gallbladder polyps is that they are often present with no noticeable symptoms. In fact, most people with gallbladder polyps are completely unaware they have them until they're discovered during an unrelated medical imaging procedure. However, in some cases, larger polyps or those located in specific areas of the gallbladder can cause symptoms similar to gallstones, such as abdominal pain, particularly in the upper right quadrant, nausea, vomiting, and indigestion. These symptoms, while nonspecific, should prompt a medical evaluation to rule out other possible conditions. Diagnosing gallbladder polyps typically involves imaging studies. Ultrasound is often the first-line investigation, as it is non-invasive and can effectively visualize the gallbladder and any polyps present. If an ultrasound is inconclusive or more detailed information is needed, a CT scan or MRI may be performed. Endoscopic ultrasound, a more invasive procedure, can provide highly detailed images of the gallbladder and is useful for evaluating the risk of malignancy. In cases where malignancy is suspected, a biopsy may be considered, although this is not routinely done. The key is to accurately assess the size, number, and characteristics of the polyps to determine the appropriate course of action. Gallbladder polyps can be broadly classified into several types. The most common are cholesterol polyps, which account for the majority of cases. These are not true tumors, but rather deposits of cholesterol. Adenomas are benign tumors that arise from the glandular lining of the gallbladder. Inflammatory polyps develop as a result of chronic inflammation. Lastly, and most concerning, are malignant polyps, which are cancerous tumors. Distinguishing between these types is crucial for determining the appropriate treatment strategy, as the management approach differs significantly depending on the polyp's nature. The treatment for gallbladder polyps depends on several factors, including the size of the polyp, the patient's symptoms, and the presence of any risk factors for malignancy. Small polyps, typically those less than 1 centimeter, are often monitored with regular ultrasound exams to check for growth. If the polyp grows larger or if symptoms develop, surgical removal of the gallbladder, known as a cholecystectomy, may be recommended. This is particularly true for polyps larger than 1 centimeter, as they have a higher risk of being cancerous. For malignant polyps, cholecystectomy is the standard treatment, and further treatment such as chemotherapy or radiation therapy may be needed depending on the stage of the cancer. Unfortunately, there's no proven way to completely prevent gallbladder polyps. However, adopting a healthy lifestyle can contribute to overall gallbladder health. This includes maintaining a healthy weight, following a balanced diet rich in fruits, vegetables, and whole grains, and avoiding excessive intake of saturated and trans fats. Regular exercise can also help. While these measures may not directly prevent polyps from forming, they can reduce the risk of gallstones and other gallbladder-related issues. The prognosis for gallbladder polyps is generally excellent, particularly when they are detected early and managed appropriately. Most polyps are benign and do not cause any long-term health problems. Even if a cholecystectomy is required, the long-term outlook is very good. Recent research is focused on improving the accuracy of imaging techniques to better differentiate between benign and malignant polyps, thus avoiding unnecessary surgeries. Additionally, studies are exploring potential genetic factors that may contribute to polyp formation, which could lead to targeted prevention strategies in the future. As our understanding of gallbladder polyps continues to evolve, we can expect further improvements in diagnosis and management.